Okay, we'll take some questions. We can go to the mics.
There's questions on the board.
Oh, there we go. Can we get a copy of the first presentation slide deck?
First presentation is brought as no.
Yeah, no, unfortunately not.
Yeah, at the bottom it says not for distribution.
And you can also contact us at the FCC or through USAC.
Do you have a website or a resource where they can contact you?
Yes, we do. And we have, well, I can give cards to anybody who'd like to reach out to me if you want to come up afterwards. In addition, there's contact information both at USAC's website. So if you type in USAC Rural Healthcare Program, you will find a bevy of information. You can also type in FCC Rural Healthcare, and you will find a lot of information there. But again, I can leave some cards, and also you can come up afterwards if you have any questions or want a card. I'm happy to follow up.
Great. The next question is, I know someone who tried to gain access to his healthcare Connect funding. No one bid on her request for funding. Can she contact anyone at FCC for assistance in this effort to reapply again?
So what I would actually suggest is that she contact USAC, because they're the ones who actually do the whole application process for all of those Universal Service Fund programs. You can, if you just type in USAC, USAC Rural Healthcare Program, you can go to their site and there will be contact information there. Alternatively, I don't know how much longer Paloma's booth is up. So she'll be here until noon. The booth is at the far end of the room. So if you want to go there, you can speak to her or also get contact information from her about who particularly you might want to contact regarding your HCF application.
Great. Why will the telecom program continue rather than just collapse it all into the HCF?
At this point, there are no plans in place to collapse the telecom program. It's a good question, but these are actually not decisions made at the staff level. They're made by the commission and the commissioners, and right now there's nothing in the pipeline to collapse that program.
Great. In the previous presentation, we heard about a cardioversion being done based on data from a Fitbit. Is that allowed?
A cardioversion. So I think that the answer is that that there's not necessarily anything that prohibits that from being done. So I think the answer to that question is it is probably allowed, unless there is, from the FTC perspective, for example, some sort of statement that the company has made to consumers that it's not going to do that, or unless there's some sort of harm being caused to consumers, in which case the FTC would be concerned. So.
Great. From an ONC interoperability perspective, what has been the biggest success since 2004 that we can learn from?
Golly, I don't think it's any one success per se. I think that's a great question. I think it could be answered from all different perspectives, kind of depending on where you're sitting and what hat you have on. I think that from my perspective, I'm very excited about looking at how our certification program can really be leveraged to support the larger care continuum. And when we're getting to a place of understanding that supporting whole health and wellness really involves bringing in more than the meaningful use providers funded through high tech. And so you see in our roadmap really kind of looking at the larger care continuum, long-term post-acute care providers, long-term services and support, behavioral health, lots of challenges and a long way to go, but it's just so critical to include them in that interoperability space. And so I think getting to the point where we're really supporting whole health and wellness and through that interoperability perspective and looking at our certification program that's really evolved from a focus tied closely to the meaningful use program and to electronic health records to really broaden to support health IT more broadly across the care continuum, and some of the optional functional criteria that we have in that looks at some of the psychosocial measures that align with the IOM measures that came out, looking at how you can capture in structured ways, issues that are so important to health and wellness, like intimate partner violence, behavioral health issues. So from my perspective, I don't know that it's any one thing, but definitely excited to kind of see that landscape broaden and really connect the larger care continuum getting to that place.
Thank you. I can also add to that, the regional extension centers, the first wave just closed last week, but they did meet their goal of reaching about 50% of primary care providers across the country, helping them get to meaningful use. And 90% of the regional extension centers will end up being sustainable in whole or in part. So I think that is one of the biggest successes so far. Next question is, just curious, is there any kind of formal routine convening of federal partners engaged in supporting telehealth? If so, what is it? How often does it convene, and what does it function? Actually, there is. FedTel is the cross-governmental work group on telehealth. I used to co-chair it, as I just finished that up in January. It meets every other month. It includes about 26 different representatives, and Samantha is working with a subset of FedTel, which is working specifically on telehealth and EHRs, and that's chaired by John White, and it was me, but now who is the co-chair with John for that group?
Stephenson, DOD.
Somebody from DOD. Yeah. So yes, we are talking to each other in the federal government. Yes.
The first question just got uploaded.
Oh, that's a long one. Okay. HRSA has increased its focus on school-based telehealth via telemedicine. The majority of these services on a national level are being provided using the school system's E-rate funded broadband based upon the understanding that behavioral and physical health services are student support services. Is there clear guidance around this issue from the FCC?
I'm not sure if I entirely follow the question. I'm assuming is the question whether the FCC is providing, or the FCC's Universal Service Fund programs are providing support for school-based clinics, or could you? Sure.
Try to clarify. So school systems receive E-rate subsidies on their internet.
Right.
And many school systems who have school-based telemedicine and telehealth programs say, please use our existing broadband, subsidized by E-rate, because we view this as a student support service, the provision of this care. There is no clear federal guidance on if that is or is not truly permissible. And with the new HRSA network grant that just closed on Friday, this is an issue getting increasing focus.
Well, I should clarify, I don't work on the E-rate program, but if you want to come up afterwards, I can get your information, put you in touch with someone who does. But at this point, the rural healthcare program definitely has not deemed these clinics to be qualifying entities, and I'm not sure that under E-rate, these school clinics, although I know this is a huge trend, especially in remote areas, but otherwise also in underserved areas. But I don't think E-rate has also specifically spoken to this as of yet, but you can come up afterwards and we can talk. Be happy to.
Can you advise regarding eligibility for Lifeline? Is Medicaid eligibility enough? Can that broadband be used for remote monitoring, not expecting payment for monitoring or devices of those patients?
So Medicaid is one of the qualifying programs, and that is sufficient for showing that you qualify for Lifeline. How the connection is how the broadband service is used is not something that the FCC oversees. So assuming that it's fine with the, that the connection works for whatever transmission is being, or data is being transmitted over it, it shouldn't be a problem.
There's a lot of focus on portals as a tool to support interoperability. These have poor utilization. Any thoughts on providing an ATM model with a physical card?
I haven't thought of an ATM model with a physical card. I'm sure there are a host of reasons why that may be challenging to implement. I do think kind of trying to look at how you can, aggregate and have your health information that matters most to you. I think one of the things we're turning to is kind of the opportunity of open APIs in that space. And I think some of the challenges that we announced kind of to speak to some of the opportunities there. So I guess maybe stay tuned for some innovative awards that we can announce. And certainly if any of them involve an ATM or a card, we'll let you know.
Great. One more question. Anybody in the audience want to ask a question? Okay, with that, help me welcome. Thank you, Jana.